So let's start JEMScN Nursing Mock Test, Part A. Number 1, Anatomy and Physiology. Which structure in the brain is primarily responsible for regulating body temperature, hunger, and thirst? A. Cerebellum, B. Thalamus, C. Hypothalamus, and D. Medulla oblongata. So the correct answer is the hypothalamus. Next, number 2, Anatomy and Physiology. The AC node, known as the pacemaker of the heart, is located in the wall of the A. left atrium, B. right atrium, C. left ventricle, and D. right ventricle. So the correct answer is the right atrium. Next, 3. Sociology. A family structure that includes parents, children, and other relatives like grandparents or uncles in the same household is called a option A, nuclear family, B, extended, C, blended, and D, single parent. So the correct answer is the extended family. Number 4, psychology. In Freud's psychoanalytic theory, which part of the personality operates on the reality principle? Option A, id, B, ego, C, superego, and D, libido. So the correct answer is the ego. 5. Microbiology. The immunity acquired by an individual after recovering from a disease is an example of option A, natural active immunity, B, artificial active, C, natural passive, and D, artificial passive. So the correct answer is the natural active. 6. Pathology. The cellular adaptation characterized by an increase in the number of cells is known as A. Hypertrophy, B. Hyperplasia, C. Atrophy, and D. Metaplasia. So the correct answer is the hyperplasia. Next, 7. Pharmacology. What does the term first pause effect or first pause metabolism refer to? A. The drug's initial binding to plasma proteins. B. The rapid excretion of a drug by the kidneys. C. The initial metabolism of an orally administered drug by the liver. And D. The drug's ability to cross the blood brain barrier. So the correct answer is the C, the initial metabolism of an orally administered drug by the liver. 8. Genetics. The Punnett square is used in genetics to predict the option A, rate of gene mutation, B, number of chromosomes in a cell, C, probability of an offspring having a particular genotype, and D, age of a genetic sample. So the correct answer is a C. 9. Administration. In nursing management, what does span of control refer to? Option A, the duration of a manager's shift, B, the range of policies a manager enforces, C, the geographical area a hospital covers, and D, the number of subordinates manager can effectively supervise. So the correct answer is the D, the number of subordinates a manager can effectively supervise. Next question, education. Education, a teaching strategy where students work together in small groups to achieve a common goal is called option A, lecture method, B, demonstration, C, cooperative learning, and D, programmed instruction. So the correct answer is the C, cooperative learning. Then 11, research and statistics. In research, a control group is important because it option A, receive the experiment treatment, B, is always larger than the experimental group, C, helps in selecting the research topic, and D, serves as a baseline for comparison. So the correct answer is the D, serves as a baseline for comparison. 12. Anatomy and physiology. Which of the four primary tissue types is responsible for covering body surfaces and lining body cavities? Option A, connective tissue, B, muscle tissue, C, nervous tissue, and D, epithelial tissue. So the correct answer is epithelial tissue. 13. Microbiology. Pasteurization is a process used to kill pathogenic microorganisms in liquid like milk by using option A high pressure, B controlled heating, C gamma radiation, and D filtration. So the correct answer is the controlled heating, option B. 14. Pharmacology. A patient taking a diuretic such as hydrochlorothazide should be monitored for which potential side effect? A. Hypokalemia, low potassium. B. Hyperglycemia, high blood sugar. C. Hypercalcemia, high calcium. And D. All of the above. So the correct answer is the all of the above. 15. Psychology, a defense mechanism where an individual justifies their unacceptable behaviors in a logically sound way is known as option A denial, B displacement, C rationalization, and D reaction formation. So the correct answer is the rationalization. 16. Pathology, the five cardinal signs in inflammations are redness, rubber, swelling, tumor, heat, calor, pain, dolor, and option A loss of function, functional laser, B bleeding, C pus formation, and D fever. So the correct answer is A loss of function. 17. Genetics. Klinefelter syndrome is a genetic condition characterized by which chromosomal pattern? A 45X0, B 47XXY, C 47 trisomy 21, and D 47 trisomy 18. So the correct answer is the B. 18. Administration. The planning process in management begins with option A developing policies, B setting objectives and goals, C allocating resources, and D evaluating outcomes. So the correct answer is the B setting objectives and goals. Next, 19. Education. An objective, reliable, and valid tool for performance evaluation against a set of criteria is a option A anecdotal record, B checklist, C essay, and D questionnaire. So the correct answer is the checklist, B. 20. Research and statistics. A measure of how spread out of the members are in a data set is known as option A mean, B median, C mode, and D standard deviation. So the correct answer is standard deviation. Part B. 21. Foundation of nursing. The ethical principle of non-maleficence is nursing means option A to do good, B to be fair, C to do no harm, and D to tell the truth. So correct answer is the C. Foundation of nursing. When documenting patient care, the SOAP format stands for A standard objective assessment plan, B subjective objective assessment plan, C source observation action progress, D situation order action precaution. So the correct answer is the B subjective objective assessment and plan. 23. Medical surgical nursing. The rule of nines is used in the emergency department to estimate the option A depth of a burn, B degree of pain in a burn patient, C amount of fluid needed for a burn patient, and D total body surface area affected by a burn. So the correct answer is the D. 24. Medical surgical nursing. In an ECG, the P wave represents A ventricular depolarization, B ventricular repolarization, C atrial depolarization, and D atrial repolarization. So the correct answer is the atrial depolarization. 25. Pediatric nursing. Which of the following is a primitive reflex that should disappear by 4 to 6 months of age in a healthy infant? Option A blink reflex, B swallowing reflex, C Moro reflex, and D gag reflex. So the correct answer is Moro reflex, option C. 26. Pediatric nursing. Intersusception, a pediatric emergency, is best described as A. Inflammation of the appendix, B. Twisting of the intestine, C. Telescoping of one part of the intestine into another, and D. An obstruction caused by a foreign body. So the correct answer is C. 27. Psychiatric nursing. A patient with anorexia nervosa is primarily characterized by A. Binge eating followed by purging, B. Normal body weight but fear of gaining weight, C. An intense fear of gaining weight and a significantly low body weight, and D. Eating non-nutritive substance. So the correct answer is the C. 28. Psychiatric nursing. Which therapeutic communication technique involves asking open-ended questions to encourage the patient to elaborate? A. Offering self, B. Giving recognition, C. Exploring, and D. Accepting. So the correct answer is C. Exploring. 29. Obstetrical nursing. The most common fetal position for a normal delivery is A. ROA, right occiput anterior, B. LOA, left occiput anterior, C. ROP, right occiput posterior, and D. LOT, left occiput transverse. So the correct answer is LOA. 30. Obstetrical nursing. Which of the following is considered a positive sign of pregnancy? A. Amenorrhea, B. Morning sickness, C. Visualization of the fetus by ultrasound, and D. Positive urine pregnancy test. So the correct answer is C. 31. Community health nursing. Administering vaccines to a community is an example of which level of prevention? A. Primary prevention, B. Secondary prevention, C. Tertiary, and D. Primordial. So the correct answer is the A. Primary prevention. 32. Community health nursing. The Janani Shishu Surokkha Karjokram in India entitles pregnant women to A. Cash assistance for home birth, B. Free and cashless delivery services, C. Subsidized nutritional supplements only, and D. Postnatal care for up to 7 days only. So the correct answer is B. 33. Medical surgical nursing. A patient who has had a thyroidectomy is at risk for hypocalcemia. The nurse should assess for a positive option A. Homancine, B. Carning, C. Trouseus, and D. Romberg. So the correct answer is C. 34. Obstetrical nursing. The most common cause of early postpartum hemorrhage within the first 24 hours is A. Retained placental fragments, B. Uterine atony, C. Laceration of the genital tract, D. Coagulation disorder. So the correct answer is B. Uterine atony. 35. Pediatric nursing. A barking cough is a classic sign of which pediatric respiratory illness? A. Asthma, B. Bronchiolitis, C. croup, and D. Pneumonia. So the correct answer is the croup. Laryngotracheobronchitis. 36. Psychiatric nursing. What is the primary symptom a nurse should monitor for in a patient experiencing alcohol withdrawal? A. Bradycardia, B. Hypotension, C. Tremors and agitation, and D. Constricted pupils. So the correct answer is tremors and agitation. 37. Community health nursing. Tertiary prevention in community health focuses on option A. Health promotion and education, B. Early detection and screening, C. Rehabilitation and limiting disability, and D. Preventing risk factors from developing. So the correct answer is C. 38. Foundation of nursing. A nurse is administering a medication via the Z-track method. This technique is used to A. Reduce pain during injections, B. Ensure rapid absorption, C. Prevent the medication from leaking into subcutaneous tissue, and D. Allow for a larger volume of medication to be given. So the correct answer is C. 39. Medical surgical nursing. Which of the following is a priority nursing intervention for a patient during a seizure? A. Restrain the patient's limbs, B. Insert a tongue blade into the mouth, C. Protect the patient from injury, and D. Administer oral fluids immediately after. So the correct answer is C. 40. Obstetrical nursing. Braxton Hicks contraction are different from true labor contraction because they are typically A. more intense and regular, B. irregular and do not cause cervical change, C. felt primarily in the back, and D. accompanied by rupture of the membrane. So the correct answer is the B. 41. Pediatric nursing. According to Erickson stages, what is the primary psychosocial task for a toddler 1 to 3 years? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. And D. Industry versus inferiority. So the correct answer is the B. Autonomy versus shame and doubt. 42. Psychiatric nursing. A patient states the FBI is monitoring my thoughts. This is an example of which type of delusion? A. Grandiose, B. Somatic, C. Persecutory, and D. Nihilistic. So the correct answer is C. Persecutory. 43. Community health nursing. Which of the following is the most reliable indicator of a community's health status? A. Crude birth rate, B. infant mortality rate, C. literacy rate, and D. number of hospitals. So the correct answer is B. 44. Foundation of nursing. What is the correct sequence for toning, putting on personal protective equipment, PPE? A. Gloves, gown, mask, goggles. B. Gown, mask, goggles, gloves. C. Mask, gown, gloves, and goggles. And D. Goggles, mask, gloves, gown. So the correct answer is the B. 45. Medical surgical nursing. A patient with chronic kidney disease should be advised to limit their dietary intake of A. carbohydrates, B. protein, phosphorus, and potassium, C. vitamin C and calcium, D. fiber and water. So the correct answer is B. 46. Obstetrical nursing. The administration of RHO, immune globulin, is necessary for which situation? A. An Rh positive mother with an Rh negative baby. B. An Rh negative mother with an Rh positive baby. C. An Rh negative mother with an Rh negative baby. And D. An Rh positive mother with an Rh positive baby. So the correct answer is the B. 47. Pediatric nursing. What is the most appropriate method for measuring temperature in a 2-year-old child? Option A. Oral, B. Axillary, C. Rectal, and D. Tympanic. So the correct answer is rectal. 48. Psychiatric nursing. Which cluster of personality disorder is characterized by dramatic, emotional, or erratic behavior? So the correct answer, so the options are cluster A, B, cluster B, C, cluster C, and D, cluster D. So the correct answer is the cluster B. 49. Community health nursing. The bag technique in community health nursing is primarily used to A. Carry medical supplies, B. Prevent the spread of infection during a home visit, C. Collect waste materials safely, and D. Store patient records confidentiality. So the correct answer is the B. 50. Foundation of nursing. When assessing blood pressure, the sounds heard through the stethoscope are known as A. Cold sound, B. Murmurs, C. Bruits, and D. Gallops. So the correct answer is A. Cold sound.